the recommendations and the implementation plan that you're going to see being played out were all influenced by these individuals. This spring, we worked together to roll out a new type of community engagement tool. Some of it is indicated here on the board, the type of engagement practices that we initiated. And it is one that got us as government officials to reach out and make sure that the center of the conversation about what creates a healthy community centered amongst the NYCHA residents themselves. It wasn't us helicoptering in and saying this is a policy. It was about really having a community conversation. As a group, we were serious about giving space and floor to those who know their community best and those who know how to problem solve within their own neighborhood. Going smoke-free will not be easy. We all know that. My mother was a 25-year smoker, and she grapples with smoking every single day. This past weekend, I was with a bunch of friends of mine playing softball in Riverbank State Park, and they all came to me and said, I don't know how I can go without smoking. And I said, well, this is the opportunity. And some of them live in grant houses. I'm from Upper Manhattan, North Manhattan, so I know a lot of people. And I said, well, the information's soon to come, and the connection to support opportunities is soon to come. So we congratulate you all for the work that has been done so far. This hasn't been a solo effort. Partnering with New York City Public Housing has been a dream for us who really believe that community engagement is essential for public health. So we thank them for that. We thank for the commitment for all of those who are in the room today to speak about how this initiative is going to be implemented and rolled out. And we want to stand and continue to stand shoulder to shoulder with you in the years to come to ensure that this initiative is a successful one. Thank you very much.
Wonderful. So we're coming up on lunchtime, and we don't have any food for people, but we are going to nourish you with the, dialogue and nourish the mind with some really exciting comments from our panel in a few minutes. We've really been privileged to work with some outstanding partners. I just want to take a few moments to build off of some of the thanks that Sadia started regarding NYCHA staff. And also recognize the working group at NYCHA that worked on this and the Resident Engagement Initiatives team, some of whom are here, for their amazing work leading the engagement. And certainly all the members of the NYCHA Advisory Group on Smoking and Health, we're going to hear from some of them, but there are many more members who gave incredible contributions. And there are also some folks who have contributed to this work earlier on, who worked for NYCHA and the Department of Health, and some of them were planning to join us today. So Ajamu Brown, Sean Robin, Kevin Schruff, and probably many more people that I could mention who really helped shape this work. And I also specifically want to thank Liz Hamby, who's the Acting Director of Health, Equity, and All Policies from the Department of Health, for her amazing leadership in this work as well. So smoke-free NYCHA certainly doesn't exist in a vacuum. We know that smoke-free policies are an increasing trend in public and private housing. And I wanted to call up another feature partner, NYC Smoke Free, to speak a little bit about this and also talk about some of our special collaboration that we did on a video project as part of Smoke Free NYCHA. So Deirdre, please come up. Thank you so much.
Good morning, everyone. So first of all, we'd like to thank NYCHA for inviting us here today. My name is Deirdre Sully. I'm the director of NYC Smoke Free. NYC Smoke Free is a program of public health solutions, one of the largest public health nonprofits in New York City. We've been working on smoke-free housing for almost 10 years. So for us as tobacco control advocates, today is really an accomplishment and a good visualization of a lot of hard work that has had a lot of years put into it. As I said, we've been working on smoke-free housing for about 10 years. And one thing as tobacco advocates that we've seen, especially in New York City, smoke-free housing was really done by a lot of market rate buildings and used as an amenity for people who are more affluent to go smoke-free. And what we saw that people who were living in affordable housing, and public housing is affordable housing, they were being left behind. So when HUD proposed the rule, we said to ourselves, we have to help them. We are a tobacco control group in New York City, so we have to partner with the Public Housing Authority that is in New York City and help them implement this policy, help guide on the road to today. So we are thankful and really grateful to have partnered with NYCHA and sat on the Smoking and Health Advisory Committee along with NYCHA residents, the Department of Health, and other tobacco control partners. We were going to show the video today, but instead I'll give you a little bit about it. Our work is really rooted in public health and community organizing. It's very two-pronged. We work with community members as well as young people. Our youth action arm is branded as Reality Check, and it really is about working with young people to turn them into advocates. So when we sat down at the table and tried to figure out how can we spread this education, what is a really dynamic and innovative way to spread what we know about smoke-free housing, going smoke-free, how do we work with young people to help spread that to their peers and to their neighbors, to their parents, so that everybody understands where this is coming from? So we decided that we would do a video project. We worked with the NYCHA Youth Leadership Councils and a really dynamic group from Brownsville, the Zone 7 Youth Leadership Council. And also we worked with a production firm, Prosper Digital, who was also very dynamic, and we kind of figured out a really unique way to tell this story, as well as put in nuggets of information about tobacco control and also being mindful of our health. So I encourage everyone in this room to really watch the video. It is not only a documentary piece, but is also educational. We really wanted to come from the angle of not being preachy and telling people what to do, but really listening to residents and hearing what they had to say and being very honest and open about sharing that information. You'll hear stories of residents talking about what they really feel about the policy. There's both smokers and non-smokers, and also told from a young person's point of view. So I encourage you, you can visit NYCSmokeFree.org, and you can also go to the Smoke Free NYCHA page, where the video is up and available for people to watch. And again, as I said, it is an educational piece, so I really encourage folks to watch it. We go not only into what the HUD rule is and information on how NYCHA went around to the community meetings to talk about this rule, but also diving into health equity, because that's really what this is about, getting down to why people smoke at the rates that they do. Why are underserved communities more inundated with tobacco retail in the way that they are? So again, please go and watch the video. Unfortunately, we couldn't show it today, but I assure you it is very informative. And again, thank you very much for inviting us here. And that's it.
And Deidre mentioned that there was a youth leadership council that helped shape the video. Youth leadership councils are groups of 14 to 21-year-old, so young adult and teen NYCHA residents, and they're members that receive training to work with NYCHA leadership to help make policy decisions that impact the quality of life of NYCHA residents, particularly from a young person's perspective. If you happen to know or have a way of reaching public housing residents who are young people, there is an application available online, and we're constantly looking for new members for those youth leadership councils across the city. It's very exciting work. So with that, we're going to call up our panel. Again, the bios of the panelists are on the back of your program. And I'm going to turn the mic over to Marvin John Jack, who's been a project manager, very instrumental in the rollout of Smoke Free NYCHA. Thank you, Marvin, for all of your amazing work. And if all the panelists could come up, and we will get started with this discussion.
Thank you. All right, so this is the part everybody's been waiting for. Everyone here is an esteemed expert, has been taking, for the past 18 months, has really been involved in making sure Smoke Free NYCHA isn't just a policy from the top down,